I have a question for you. If you steal someone's heart, do you get cardiac arrested?
Turned to stone. It was completely sealed by Linda.
Great! Now you have become much stronger than before, my heroine. Good luck!
Hello guys, welcome to our channel. In this episode, we will discuss the basics of cardiovascular system. I am the medical coding guy. Cardiovascular system function is to make sure your body gets the oxygen, nutrients, and other things it needs, and get rid of things it doesn't. It includes the heart and the blood vessels. Abnormalities or injuries to any or all the parts of the cardiovascular system can result in serious health complications. Common conditions that can affect the cardiovascular system include coronary artery disease, heart attack, high blood pressure, and stroke. The cardiovascular system is made up of heart, the blood vessels, which is your arteries and veins, and of course your coronary arteries. Proper understanding about these parts can help you read the medical documentation and also helps you to assign the right codes for your patient. Arteries and veins are the two of the body's main vessels through which the blood flows inside the body. The arteries carry oxygenated blood away from the heart. So remember the term, away, okay? Letter A, starts from letter A, away. While the vein carries unoxygenated blood back to the heart. So that's letter V, vein, going back. I know, it sounds different, all right? From the word back and vac, but this is how you can remember these two vessels right here, all right? Going away, artery. Going back to the heart, vein. And on the right side of the screen here, you can see the different chambers and valves. So just try to check your book, all right? Your ICD and CPD book has this information, all right? Has these images. So you can probably check that if in case you get lost about the different chambers and different valves of your heart. But just remember guys, we have 4 chambers, all right? Divided into left and right side, and each of these chambers has its own valve, all right, which is like the hatch that opens and closes, all right? So the blood will enter towards the next chamber, okay? As for the coronary vessels or coronary arteries, these are the vessels that supply blood towards the heart, okay? So please take note of that. There are different parts or different names of your coronary vessels. So it's also divided into left and right side, okay, depending on the location. You will be needing this for coding your CABG procedure and also with regards to your myocardial infarction diagnosis as well. Please take note about this, okay? As for the ICD-10-CM coding, guys, we have some guidelines located in the ICD-10-CM guidelines, okay, that you can find under your Chapter 9. Proper understanding of anatomy is one of the key components. Let's say, for example, you have a case of myocardial infarction for the patient. So you have to at least know where to find it in the ICD-10-CM guidelines under Chapter 9, because you have to take note the difference between the STEMI or ST elevated myocardial infarction or non-ST elevated, okay? So check the portion of the heart that is affected. By the way, myocardial infarction is what? We can call it a heart attack. So it's caused by a blockage or lack of blood flow in the coronary arteries, okay? So take note guys, if you're dealing with cardiovascular diagnosis under your ICD-10-CM, all you need to do is to go to, of course, Chapter 9 of your chapter-specific guidelines, okay? And then after that, just check whatever guideline your scenario is giving you, okay? For example, it's about your myocardial infarction, right? Check the difference between ST elevated myocardial infarction and your non-STEMI, and also the difference between acute and your subsequent myocardial infarction, okay? So again, everything is listed here, so take time to read this. If in case you will be needing this during your exam, just need to visit this one, okay? All right. As for the next important topic under your ICD-10-CM for your cardiovascular system, you have your hypertension. So hypertension is, of course, the pressure buildup that's pushing against the arterial wall. All right. So again, it can be related to heart failure, chronic kidney disease, or both. Or it can also be a secondary hypertension, or it can just be an essential hypertension, which is not caused by these things that I have mentioned. Okay. So know your guidelines about the proper coding from your I-10 to I-13. All right. So hypertension in your ICD-10-CM guidelines is located, all right, at the beginning of your chapter 9. All right. So again, if the patient has hypertension, you have to check if it's caused by what? If it's caused by your heart disease or your chronic kidney disease. Okay. So you can just check here what are the guidelines involved. Sequencing is also important with your hypertension codes. All right. Especially if it's related to heart disease and your chronic kidney condition. Okay. So please take note of that. All right. Next. So let's have an example. A 66-year-old man was admitted this morning because of acute ST-elevated myocardial infarction of the inferior wall. As I have told you earlier, guys, check the type of MI, all right, in the scenario. So it's mentioned here, it's acute and it's ST-elevated. So what you need to do is to go to your type, which is mentioned as acute and STEMI, okay? So what's the location of the myocardial infarction? It's in the inferior wall. So again, go to your index. So you have two options here. You can either go to your index if you don't have any choices given, just like in the exam. But if you're given choices in the exam, feel free to search it directly, okay? But let's try doing this using your alphabetic index, okay? So you have to check the main term for myocardial infarction, which is going to be infarct or infarction, okay? And check the next term, which is your myocardial. All right, so go to letter M. All right, myocardium or myocardial. So it routes you to go to I-21.9, but it's mentioned right here in the scenario that the location is inferior wall. So you have to check the location as well here. So you have to check the word STEMI after this one. Okay, so go to the second line right here. You have your ST elevation or STEMI. So what's the location? Inferior wall. So go to the next term right here, which is inferior. It says here wall. So you can say the code for today is I-21.19. But remember, guys, you are not allowed to code directly from your index. So you need to go to your tabular list. All right. Check the code I-21.19 and confirm. All right. If it's complete, then we can code this. ST elevation myocardial infarction involving the inferior wall. Okay, this is our code for this patient. Okay, so again, that's going to be easy, right? And let's now proceed to the CPT coding of cardiovascular system. Here are some major guidelines under your 3000 series for cardiovascular system. Okay, so before you take your exam, please make sure to review these things. Okay, it's quite important to know, like your pacemaker. So check for the insertion, removal, replacement of the battery, of the leads, of the electrodes. So you have to check the components of your pacemaker and also implantable defibrillator. These two are different devices, okay? And then for the concept of CABG, guys, you have to check how many veins or arteries were procured or harvested to be used for CABG. CABG is coronary arterial bypass graft, wherein they will take out or procure an artery or vein from the patient and attach it towards the diseased part or the damaged part of the coronary vessel. Okay, and also central venous access. Check if it's peripherally inserted or centrally inserted. All right, and just check the age as well. Some codes in the CVA or central venous access requires you to check the age. Left and right heart catheterization. This is quite difficult, guys, so please, I'll put a star here. One of the most difficult topics of your cardiovascular CPT coding. So just check if it's attached towards if the catheter is inserted towards the left or right side of the heart. And next is your PTCA, percutaneous transluminal coronary angioplasty. So this procedure is insertion of stent, doing an atherectomy procedure, or placing a balloon towards a coronary vessel. All right. to treat constriction or any clots that's formed inside the coronary artery. So it's more of like repairing the coronary artery because of a disease process of the patient, okay? And also you have your diagnostic procedures for cardiovascular system. So just try to check these things before you go for your exam. It's very important, okay? Now let's have one example for this CABG. Coronary arterial bypass graft was done with one saphenous vein graft, okay? For CABG procedures, you can check these 3 code sets right here under CABG. So please be mindful that you have to check how many arteries and veins were procured and used for CABG. Simple as that, but always go first with the arteries, okay? So again, if it's only vein, code the following code sets here depending on the number of vein grafts used. And if it's combined, go first with your arterial grafting located here under your 33533 onwards, okay? And if it's combined with your arterial grafting, the doctor has used vein grafts as well, use the middle section, okay? Not the first section I told you earlier. Use the add-on codes right here, all right? In conjunction with your arterial grafting. And do not forget to check if the procured artery or vein needs to be coded or not, okay? In this case, I've mentioned earlier it's a saphenous vein graft that was used, right? So only one saphenous vein graft was used. So as you can see here, guys, procurement of saphenous vein graft is already included in the description of work for 33510-16. So you have 33510 here as your only code for this scenario that I've given, okay? So please take note of that. You don't need to code your saphenous vein grafting. But if it's other vein, other than your saphenous vein graft, you might want to use this 35500 or 35572, depending if it's an upper extremity vein or a femoral popliteal vein that was used, okay? And that's it for this short video about the basics of cardiovascular system. We'll have more of this in the future, and do not forget to like and subscribe for more updates about medical coding. If you have any questions in mind or comments or anything that you want me to discuss in the future, comment down below and I will try to have those topics in the future. Again, see you next time. So long, and always remember, without knowledge, there is no power. Goodbye.